Thank you for allowing me to talk about this topic, which is about the effect COVID-19 and the pandemic is having on the mental health issues for individuals in our community, and certainly across our nation and world for that matter. When I think about the impact of COVID-19 on mental health issues, I think of this in a couple of different categories. One, maybe individuals who were not necessarily suffering from mental health issues or mental illness before the pandemic. And even for those who felt pretty well adjusted or not suffering from mental health issues prior to the pandemic, I think there's been a significant testing of the resilience of any of those individuals during this time. And then if you take someone who already had mental illness or significant mental health concerns or addictions, these things were certainly intensified or had the potential to be intensified during this time. And that's exactly what we're seeing in the clinics and in the hospitals. And we think about how this affects the mental health of individuals. We can think of it in many different ways. Each of us may have had to deal with the illness of COVID itself. We may have had family members or friends who have had it, so we have that baseline fear of the health and integrity, or even the life of individuals that we know personally and that are important to us. We may have not been affected so directly in that manner, but maybe we're affected more by all of the changes in our environment and our world that we have to do to try to keep ourselves and our communities safe. So the closings of schools, the limitations on us getting together with friends, family, our usual support systems. And another important factor, there's been limitation on the mental health services available for individuals during this time of crisis because of the infection risk in clinics and in hospitals. So we have seen a number of ways in which COVID-19 is directly impacting people's mental health. So we look at the normal ways that people might be protected from mental health challenges or mental illness, and many of these are affected by even the basic things that we have to do for infection control policies around our communities and in our environments. So we see a number of ways that COVID-19 is affecting mental health issues for individuals. Many times mental illness actually is precipitated by a major stressor in our environment or in our life. And that can be some of the stressors that COVID-19 is bringing to us. So we see the onset of major depressive disorders in individuals. We're seeing the onset of anxiety disorders in individuals who may have otherwise not had those illnesses before, but this is the stressor that is bringing it out. And certainly for individuals who are already dealing with those issues, intensifying it. I think some of the biggest concerns comes in the way that we're seeing increases in suicides and increases in overdoses in our communities across the nation. Earlier this summer, the CDC issued a notice that compared to the year 2018, there was about a 150% increase in adults surveyed who had seriously considered taking their lives in that month compared to the same month in 2018. So significant changes, and that really is what's happening in our anecdotal experience in our clinics and our hospitals, with more individuals coming in with acute mental health crises and having a higher severity of symptoms and challenges that they're facing compared to our practice even a year or two ago. I've often asked, what are the warning signs that families should look for if they're worried about an individual in the family? And I think the broadest category is to consider, changes. If you see changes in your friend or family member, your loved one, major changes in how they're interacting with you or how they're interacting with the world, those are some of the things that lead us to concern about the person. When we get concerned about the mental health challenges leading to more of a mental illness or more severe situation, we also look at how that's really affecting their ability to function, such as their ability to go to work, to show up for school, their ability to handle basic routines in their lives. And as we see things start to deteriorate, the other warning signs you might look for would be changes in their physical health. It could be changes in their sleep cycle, changes in their ability to concentrate, changes in their ability to function in terms of eating, drinking, the basic demands of life. And then, of course, major warning signs if there's any talk about suicide or more of a prominent preoccupation with death or hopelessness. These are major warning signs for families to be aware of. And then, of course, the next question is, what can family or friends do for individuals that are stirring that concern? Well, on the most basic human level is to be that support for the individual. To know that the support of family and friends is one of the major factors for individuals to stay mentally healthy. And it's one of the major factors to help people in recovery processes. So be that support person, share the compassion, be open-minded and supportive of what they're dealing with, and to provide a safe space for them to talk about the challenges that they're facing. And if some of these more serious warning signs are there, to also offer to assist the person to get more professional help. That can be through, outpatient clinics. It can be through helplines. And when it's more serious, where there's any discussion of suicide, any discussion of serious problems with safety, then the individual should be assessed in a local emergency room, including perhaps even needing to call 911 if a person is in the midst of taking action on their life. So we have a full spectrum of ways that people can intervene, knowing that an individual may need a very high level of intervention, such as a trip to the emergency room to get assessed, where mental health services can be assessed and the person can be sent then to the appropriate clinic, hospital, or treatment center for the individual to receive treatment. So certainly the COVID-19 has impacted our lives immensely, and for mental health issues in particular, we're seeing a significant increase across the country, and especially in our communities, because where we practice and where we live, we're more accustomed to knowing what the norms are in terms of how significant or how severe the mental health crises are. And there's certainly been an uptick in the local communities here.